Good afternoon, bon après-midi. I hope everyone's doing well, and for those who are not working shifts over the weekend, I hope everyone had some time to rest and reflect. To review our case count as of today, we had a new case related to a cluster investigation on Saturday, and no new cases since then. Thus, we are now at 5 cases. We may yet see another 1 or 2 cases related to these clusters, but we have also received a number of negative results. Related to the public posting for Elias, Dental, and Bethany Church, many people came forward for testing and no cases have been found to date amongst them. I'm happy with these numbers and the results of these investigations, and I feel that the risk to the public related to these cases is very low. A little summary in French. Pour revoir le nombre de cas en date d'aujourd'hui, nous sommes maintenant à 5 cas. Le dernier depuis 2 jours est lié à une enquête qui est toujours en cours. Nous sommes satisfaits de ces chiffres et des résultats de ces enquêtes. Les risques pour le public en rapport avec ces cas est très faible. This is a good time to repeat and remind everyone of a few aspects of prevention. Safe spacing or physical distancing is how we prevent spread of COVID in cases where someone unexpectedly among us may have the infection. It could be you, it could be me. Frequent hand washing, covering coughs and sneezes, avoiding face touching are the additional weapons that we have. By applying all of these measures now and for the foreseeable future, we can, when cases pop up, decrease the number of contacts and therefore the amount of contact tracing that will be required if you or your loved ones test positive. More importantly, in this way, we will protect each other and protect our most vulnerable citizens and communities. Over the last few weeks, I've heard more and more stories about how many people are adapting to safe spacing. I heard about FaceTime family gatherings, virtual birthday parties, and Zoom cocktail parties. Social spacing and social innovation are going hand in hand, and this is so heartening to see. As we all know now, we may be having to do this for months to come. I talked on Friday about the need for war measures, as this is a war. Let's not underestimate how brutal a war this could be if we let down our defenses. Protecting the North is Canada's duty and our responsibility. When COVID tries to make its way in, we must not only flatten that curve, we need to beat it to the ground. La protection des régions du Nord est notre responsabilité. Quand la COVID commence à se manifester au Yukon, il nous faut aller beaucoup plus loin que aplatir la courbe. In order to fight this fight, I think of 3 lines of defense. The first line is you and me, and all of us as everyday social, working, ordinary Yukoners. We are the infantry, 40,000 strong. Social spacing, physical distancing may not prevent the influx of further cases, but they will prevent cases from spreading around. The second line is our public health workforce. These are the nurses who do the tireless work of connecting with individuals who may be exposed to COVID or who test positive, identifying their contacts, ensuring that those contacts self-isolate or self-monitor, check up on their symptoms, answer their questions, and follow them to recovery. They call themselves the Mop-Up Brigade, quietly working at a low profile and containing cases to protect us from the virus getting out. The command center is Yukon Communicable Disease Control, and the periphery are the community health centers around Yukon, ready to detect cases, confirm results, talk to the patients, ensure compliance with direction, and above all, do that methodical contact tracing. Working with our epidemiologists, with the medical support from Dr. Elliott and myself and others, and in coordination with our counterparts around the country, We determine and revise our testing strategy constantly, as well as our public health management strategy and our support to the healthcare workers who are providing healthcare and testing those at risk. And then to expand the battle metaphor further, we have the cavalry waiting in reserve, the doctors, nurses, nurse practitioners, and the cadre of supporting workers. When there are leaks in the front line, when cases escape from public health follow-up, or individuals deteriorate to the point of needing healthcare, the healthcare providers do their job. We have a formidable force of healthcare workers, skilled and motivated as they ramp up their preparations. The plans underway at Yukon Hospital Corporation and within community nursing to ramp up capacity are impressive. But they could never stand the force of incoming COVID if it were not for the two lines before them. COVID uncontrolled would overwhelm our healthcare system just as it has in so many other parts of the world. COVID will not behave differently here than anywhere else. But we can, if we stay our positions, we can meet this virus head on. This is We the North for real. That's all I have to say for today, but I'm happy to answer questions. Merci.
Julian, do you have a question? Yeah. We'll go first to the folks in the room.
Julian Janak, Yukon News. I just wanted to ask about the couple from Quebec who traveled all the way to Whitehorse from Quebec and then took a plane to Old Crow. When it comes to something like that, what measures are you considering to ensure that doesn't happen again?
Yeah, to me, this is a very human story. It's a story of two people who were afraid, who wanted to seek refuge, and who thought they were going to a safe place. And although there were already measures in place to guide their behavior, clearly some of those measures could be stepped up, and those measures are being stepped up. For instance, conversations with the airline companies to make sure that the message is clear, that we want to keep Yukon communities safe. In addition, you will have heard from OCRO directly and the chief of OCRO about the measures that they are taking to have written permission to enter OCRO in this case, and I really commend the levelness and the thought that went into the measures that OCRO is taking. They are certainly a particular community in Yukon at risk because of their isolation from road access. It's important to note that these people, though misguided, they did not contravene any order. They're now being given or have been given appropriate guidance, and so that they can better play their role in preventing COVID-19. So to me, it's a matter of what I was saying the other day about reinforcing measures that we have already put in place. So how do you reinforce? To me, it's a combination of communications, so bolstering the communications, making those messages easier to receive. It's a matter of education. It's a matter of then having the enforcement mechanisms at the end. But the first thing is really supports and communication, and that's the kind of the package of reinforcement.
Vince Fedorov for Gabriel Plonka, Whitehorse Star. How do we determine when things can start reopening? For example, how many weeks should we physical distance after the last case is discovered?
It's a really good question. The question about how long do we keep doing this and how long after the epidemic, and we're watching now as China, for instance, is starting to relax their social measures. We don't know yet. We don't know the answer, but we're still looking at what are the different models of the impact of the epidemic itself. So we don't know for sure how long this is going to take. We think months, and by then it'll be guided by what will it be in the course of the epidemic. If, for example, you relax too early and you have too big a susceptible population, then you may invite a second wave. So everything has to be measured as we go, modeled ahead, and at this moment, we don't know those answers, but I would love to know.
Okay. So Julian, and then we'll go to the phone line. So after Julian's question.
Can you just elaborate on the fifth case? You said Saturday. Can you just maybe provide a little bit more detail and maybe elaborate on it?
Well, it's related to the cluster. I can't give you a lot of personal details, but I can tell you that as for all of the cases, that case is doing well, and has there are now a total of 5 cases. 4 of the cases are related to one cluster, though. So that's why I feel, although we may have 1 or 2 cases related to that first cluster, we're really near the end of the line. But everyone is doing well. No one has had to seek health care, and we're expecting that to continue.
Okay, it's Cam Heat, Government of Yukon. We're now going to go to the teleconference line, and we'll start with CBC. Go ahead, Steve, with CBC.
Hi, thank you. Dr. Hanley, correct me if I'm wrong, but did you say that the couple didn't break any order? And if so, how didn't they break any orders by not immediately self-isolating? Also, where and how exactly did the system fail? How exactly did the system currently in place fail that allowed this to happen? What specific changes are in the works? And will this couple be facing any charges?
To your last part, the question is back to the Old Crow incident, which has captured everyone's interest, and about the couple who arrived in Old Crow. So as I said, they did not contravene an order and therefore will not and could not be charged. The order as it stands is for visitors or travelers to Yukon to self-isolate, but it also allows for people to reach a safe place of self-isolation. Of course, it was not intended in this case to be Old Crow, and Old Crow took appropriate measures as a chief and council and community under their own planning. The order as it stands would not prevent a person from taking otherwise a second means of transport, including a flight, to reach a place of safe self-isolation. And as we said, we have asked people to seek support if they have difficulty with arrangements through the COVID info email. So the other questions around what exactly is being done to improve, and again, as I've tried to make clear the last couple of times, there's always going to be a gap between when the order is made and then the catch-up with what I call the reinforcement measures. So, of course, there are going to be stragglers, there are going to be leaks. So instead of running after all the leaks, the best thing is to improve communications, such as having scripts for the airline check-in, such as having greeters at the airport to provide people directly with information. So these are some of the things that are being planned, and for continuing to emphasize and propagate the right messages.
Okay, we're now going to go to Matisse with Radio Canada. Go ahead with your question.
Oui, M. Hanley, plusieurs questions en français. Déjà, le 5e cas, est-ce que vous pourriez préciser dans quelle communauté est-ce qu'il a été enregistré? Ensuite, j'aimerais savoir que vous, concernant les habitants d'Old Crow qui ont des inquiétudes par rapport à ce couple qui les a finalement mis exposés à un danger de voir apparaître un premier cas, quel serait votre message à des communautés qui s'inquiètent de voir apparaître un premier cas parmi leur population? Et enfin, j'aimerais savoir aussi si vous pourriez juste repréciser depuis quand exactement les visiteurs qui arrivent au Yukon doivent s'auto-isoler pendant 14 jours. Est-ce que c'est depuis vendredi officiellement?
Donc, je crois qu'il y a 3 questions et je ne sais pas si j'ai bien compris la deuxième, mais on commence peut-être avec les autres. Je pense que c'était la provenance du 5e cas. Donc, tous les cas sont de Whitehorse. Donc, on n'a pas un cas qui est à ce moment lié à une autre communauté. Je pense que le 3e s'agit depuis quand l'ordre pour les voyageurs d'être soumis à isolation, la quarantaine. Et ça, c'est depuis le 22 mars 2020. Et peut-être vous pouvez expliquer la deuxième partie parce que j'ai pas bien compris.
Message, en fait, aux communautés qui s'inquiètent peut-être de voir ce genre de situation se reproduire à nouveau.
Bon, il y a toujours un risque pour ce genre de cas de revenir, donc, mais ou à Whitehorse ou dans les communautés. Donc, c'est pourquoi on demande à tout le monde d'être toujours en état de préparation et toujours d'améliorer les préparations. Donc, c'est bien possible qu'on va voir un autre cas dans les jours de venir, peut-être 2, peut-être 3, mais avec les mesures publiques, avec les mesures de santé publique, de faire l'isolation, de faire des suivis de contact, on peut rester confident qu'on peut encore mettre en avance l'avance de l'épidémie et de nous protéger.
Bon, merci Métis. On va aller à l'autre journaliste, c'est Marine avec Aurore Borel. Et si c'est possible de répéter la question en anglais?
Oui,
si c'est possible. OK, c'est à vous, Marine.
Oui, merci. Est-ce que vous m'entendez bien?
Oui.
Ouais.
Allô?
Oui, on vous entend.
Allô? Est-ce que vous m'entendez?
Yes, oui, nous attendons. S'il vous plaît, continue.
D'accord, merci.
Bienvenue.
Merci. J'aimerais savoir quelles sont les mesures qui sont prises pour les personnes sans abri et qui peuvent aussi être à risque. Ça, c'est la première question. Et comment vous pensez continuer à offrir des services pour les personnes sans abri, les personnes en difficulté à Whitehorse pendant cette épidémie?
Oui, c'est une très bonne question pour les gens sans abri. It's a question about how are we helping to protect people who are homeless, and to offer supports to people who are homeless. Je peux dire que c'est quelque chose qui nous concerne beaucoup et qu'il y a un groupe entre le centre commande contre l'épidémie ici et les services sociaux du Yukon de mettre en place des solutions pour avoir tous les services continus pour les sans-abri, incluant les domiciles pour ceux qui ont besoin de se mettre en isolation, en quarantaine. Et aussi par exemple, si on a poursuivre les mesures pour protéger pour la distance physique, par exemple au shelter d'urgence à Whitehorse, et pour avoir plus de places disponibles pour les personnes si, par exemple, on est à maximum capacité à Whitehorse Emergency Shelter. I'll answer in English about the services for the homeless. This is a very active and changing day-to-day piece of work that concerns us all. It's about how do we help and protect those who are homeless from COVID and offer the supports necessary. So this includes the proper spacing at the shelter. It includes places for people who are who may have to go under isolation, a safe and supported place for them to stay, and to have other places of for people to stay if the shelter, because of its adherence to space requirements, is full and needs extra space. I know that there are details being worked out that are not that I don't have under my fingertips, but that are imminent.
Okay, thank you, merci Marine, and now we'll continue with with Brenna with Canadian Press. Brenna, are you there? Canadian Press. Okay, we'll move along to Tim with CKRW. Tim, go ahead.
Hi, good afternoon, Dr. Hanley. Just wanted to ask about with the flights. I was talking with Joe Sparling from Air North, and he had told me this afternoon that Vantaquachen First Nation, as well as now the government of the Northwest Territories, have been requesting passenger manifests. He had also mentioned the Yukon government was maybe doing the same thing. Can you just elaborate on that, the manifest, if the Yukon government is requesting that from both airlines, and as well the flight information? There was a link on the federal government website that actually pointed out to the direct flight from March 14th. That link went live on the weekend. I'm just wondering if the Yukon government is deferring any flight information now to the federal government, or why wasn't this information posted earlier, and why did we have to find out from the federal government about particular flights?
So if there is a person who tests positive for COVID and who has a history of a flight or flights within the previous 14 days, there is actually a process, and that's where the government will request flight manifest information directly from the airline. And so then only the people who are in that area of risk, according to where the person, the individual was on the plane, according to that area of risk is actually defined by basically 2 meters in front and 2 meters behind. And that information, when we have it directly from the manifest, means that we don't then need to post that information publicly. So the relevant people were already contacted. The contact tracing was underway, and this is a methodical approach. It's a very precautionary approach because, in fact, the risk of travel within an airplane is actually low. So it's a precautionary approach, but it's directly to the people who are the ones defined to be at risk, depending on where that person was. So in this case, the posting of the flight, which is part of a national process that is itself being developed, was in fact unnecessary.
Okay, thank you. Did we get Brenda back with Canadian Press? Are you on the line now? Okay. Are there any other media still on the landline that we've not gotten to yet? Okay. We have 2 more questions directly in the room. I'm going to start with Vince is going to come ask a question on behalf of Gabrielle with Whitehorse Star.
If this continues for months, there will likely be negative impacts on people in continuing care facilities who are unable to have visitors. Will there be any systems set up for visitation by phone or video?
Yeah, so the question about visitation with continuing care, and it's certainly something that distresses us all, but there are already, I'm not quite sure what the question is about a system. There are certainly individually means for people to either have visual contact with telephone support or personal ways of being able to have virtual visits, and indirect sort of relaying of communications. I think it's certainly the personnel at continuing care are doing their best to look for other ways to make sure that residents have as much contact as they can within the restrictions.
Okay, thank you. We'll now go to our last question. Joining us in the room, Julian with Yukon News.
I wanted to circle back to the couple from Quebec. Where are they now? Are they in Whitehorse, or do you know anything about that?
I don't follow their specific details, nor is that public information. What I can tell you is that they are safely in self-isolation.
Thanks very much, folks.